Hello, everyone, and welcome to our final webinar in our Open Enrollment 2026 series, Office Hours. Thank you for joining us today. My name is Nicole Rapfogel. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplace and Medicaid. We are a nonprofit policy organization and are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes, and while we hope you will learn a lot, we are not able to offer continuing education credit for our webinars at this time. After the webinar, we'll circulate the slides, a video recording of this presentation, and other resources. We'll also post everything to the Beyond the Basics website. Automated captions have been enabled for this webinar. To view them, click the More option with 3 dots at the bottom of your screen and turn on closed captioning. All participants are muted and in listen-only mode. If you'd like to ask a question, click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We will be monitoring questions and will have several breaks for Q&A throughout the session. We'll also try to answer as many questions as we can in the chat as we go along. We have a lot of content to cover today and may not be able to answer every question asked, but we will have a record of all your questions and will use them as a guide for future resources and presentations. You can also email your questions during and after the webinar to beyondthebasics@cbpp.org. Today's webinar is the final in our fall webinar series. You can find the slides, recordings, and webinar and resources from all the webinars in the series on the Beyond the Basics website. Today's webinar runs through several scenarios enrollees and assisters may encounter related to immigration, redetermining premium tax credits, Medicare, and re-enrollment. We also encourage you to ask any questions you have, and we will reserve plenty of time to discuss them. Today's presenters include Jenny Sullivan, Director of Health Coverage Access at CBPP, Claire Heyison, Senior Policy Analyst at the Center, and me, Nicole Rapfogel, also a Senior Policy Analyst at the Center. We are also grateful to have 5 guest technical assistance providers to help us answer questions today. Lynn Cowles, Steve Goldman, Tierney Strandberg, Grace Wagner, and Adam Van Spinkeren. One important thing to note, the premium tax credit enhancements currently in effect expire at the end of 2025. In this webinar, we assume these enhancements, including the availability of premium tax credits to people with incomes greater than 400% of the federal poverty level, or FPL, are no longer available in 2026. This is subject to change pending congressional action. Because open enrollment begins this Saturday, November 1st in most states, let's run through some key dates for marketplace enrollees. To avoid unexpected premium charges, select a plan or opt out of auto re-enrollment and auto pay by December 15th. This is especially important for immigrants with income below 100% FPL who are losing PTC eligibility, and people with income above 400% FPL, who will lose PTC eligibility if PTC enhancements are not extended. People who have their premiums set to auto pay could pay more than expected or overdraft their accounts if PTC enhancements expire. If someone is automatically re-enrolled, December 31st is the last day to cancel coverage before they are charged for their January premium. If PTC enhancements are extended after open enrollment begins, it's important to return to the marketplace by January 15th to see if premiums have changed. In states that use healthcare.gov and most state-based marketplaces, Open enrollment begins this Saturday, November 1st, and ends January 15th. There are a few exceptions. Open enrollment is already underway in Idaho, and 7 states end open enrollment on January 15th. Now, Claire will get us started with our first scenario.
Thanks, Nicole. So this scenario here is going to focus on Medicaid eligibility, PTC eligibility, and families with mixed immigration status. All right, so here we have the Zamora family. Leo and Sophia are married and they have a daughter, Anna, who's 2 years old. They live in Missouri, which is a Medicaid expansion state. And when they apply for coverage, Leo is the sole earner for the household. His projected annual income is $20,000, making their annual household income 94% of the federal poverty level. Leo and Anna are U.S. citizens, while Sophia is a legal permanent resident who received her green card 4 years ago. So let's see what health programs this family is eligible for. First, let's look at eligibility for Medicaid and the premium tax credit based on income. In Missouri, where this family lives, the income threshold for Magi Medicaid for parents and childless adults is 138% of the federal poverty level. The income threshold for children and pregnant people is even higher at 305% of the federal poverty level. As we've discussed, the Zamora family's income is 94% FPL, putting them below the income threshold for Magi Medicaid in their state. Now let's look at Medicaid and CHIP eligibility based on immigration status. In order to qualify for Medicaid, a person must either be a U.S. citizen or have an immigration status that falls under the qualified immigrant category. This includes lawful permanent residents, also known as LPRs or green card holders, Cuban and Haitian entrants, COFA migrants, and others listed here. However, some people with a qualified immigration status must wait 5 years after obtaining their eligible immigration status before they become eligible for Medicaid. This is called the 5-year bar. Lawful permanent residents, like Sophia, are subject to the 5-year bar. So, looking at Medicaid eligibility based on income and citizenship, Leo has income below the Medicaid eligibility threshold in his state, and he is a U.S. citizen, so he is eligible for Medicaid. Anna similarly has income below the Medicaid income threshold for a child in her state, and she's a U.S. citizen, so she's also eligible for Medicaid. Sophia has an income below the Medicaid eligibility threshold, and she is a lawful permanent resident, which is a qualified immigration status. However, she is subject to the 5-year bar. She will not be eligible for Medicaid until 5 years after she received her green card, and she only received her green card 4 years ago. This means that Sophia is not eligible for Medicaid. But does Sophia qualify for marketplace coverage with the premium tax credit? Let's see. Prior to plan year 2026, people who had income that was too low for the marketplace, but who were ineligible for Medicaid because of their immigration status, were eligible for marketplace coverage and the premium tax credit. This is changing in plan year 2026. Beginning in plan year 2026, lawfully present immigrants with income below the poverty line who are not eligible for Medicaid because of their immigration status will no longer be eligible for the premium tax credit or cost-sharing reductions. This includes lawful permanent residents and other lawfully present immigrants who are subject to the 5-year bar for Medicaid. People in this situation can still get marketplace coverage without premium tax credits but given that they have income below the poverty line, it's likely to be too expensive for them. We also wanted to take this moment to remind you all of some other upcoming changes related to immigration status and health coverage eligibility. So beginning on October 1st, 2026, only U.S. citizens, LPRs, Cuban and Haitian entrants, and Compact of Free Association or COFA migrants will be eligible for Medicaid or CHIP. All others that have a qualified immigration status currently will no longer be eligible for Medicaid or CHIP. Beginning in Plan Year 2027, only U.S. citizens, LPRs, Cuban and Haitian entrants, and COFA migrants will be eligible for PTCs and CSRs in the marketplace. Other lawfully present immigrants who are no longer eligible for PTCs and CSRs can still purchase marketplace coverage at full price. But the first bullet point here is the one that is relevant for Sophia. As a result of this new change, Sophia does not qualify for PTCs because her household income is below the poverty line and her immigration status disqualifies her for Medicaid. She is still eligible for marketplace coverage at full price, but this is too expensive for her, so she decides to go without insurance. The chart here shows the insurance type that each family member has, so Leo and Anna have Medicaid while Sophia is uninsured. Now, in March 2026, Sophia gets a new job that increases the family's projected annual household income to $35,000, or 131% of the federal poverty level. They return to healthcare.gov to update their income. Does Sophia qualify for PTCs now? So going back to our changes coming slide, the key thing to note here is that the ban on PTCs and CSRs is for lawfully present immigrants with income below the poverty line. Sophia's new household income is above the poverty line. This means that she is eligible for PTCs. And taking a look at eligibility for PTCs based on immigration status, we see that people with a qualified immigration status for Medicaid are also eligible for premium tax credits. This includes people who are subject to the 5-year bar for Medicaid, at least prior to 2027. In addition, people with other lawfully present statuses, such as those listed on the right, are eligible for PTCs. I've noted at the top of this slide that this is a list of eligibility for PTCs based on immigration status as of October 2025. And it's important to note that date because, again, in Plan Year 2027, only U.S. citizens, lawful permanent residents, Cuban and Haitian entrants, and COFA migrants will be eligible for PTCs. All other immigration statuses on this list will be ineligible for PTCs as of Plan Year 2027. This slide lists additional information about immigrant eligibility for PTCs. So currently, an applicant for the statuses in the box on the left are eligible for PTCs, and the people with immigration statuses listed on the right must also have employment authorization if they are 14 years old or older. Getting back to the Zamora family though, because the household income is now above 100% of the poverty line, Sophia qualifies for PTCs. Leo and Anna remain eligible for Medicaid. The key takeaway here is that people with income between 101 and 138% of the federal poverty level who are ineligible for Medicaid because of their immigration status can still qualify for PTCs and CSRs in both Medicaid expansion and non-Medicaid expansion states. But let's pause here and, it's great that Sophia is eligible for PTCs, but can she actually enroll in marketplace coverage with PTCs as a result of this income change? Oops. sorry. Um, Unfortunately, not. The family's change in income does not make Sophia eligible for a special enrollment period or SEP. This is because the SEP for becoming newly eligible for PTCs because of an increase in income only applies to people who are already enrolled in marketplace coverage. Because Sophia was previously uninsured, she does not qualify for this SEP, and she remains uninsured either until open enrollment or until she qualifies for a different SEP. Now I will turn it over to Jenny to go over our next scenario.
Great. Thank you, Claire, and good afternoon, everybody. We are diligently trying to get to your questions in the chat, but we will pause for more questions after this scenario. I'm going to walk through the scenario about the Rodriguez family, which deals with employer coverage affordability for the employee as well as for the spouse and dependents, as well as tax filing status requirements for the PTC. Let's see. There we go. Okay, so this is the Rodriguez family, and there are 3 people in the family: Ramon and Lucia, who are married, and their daughter Amelia, who's 10 years old. They live in Delaware, and both Ramon and Lucia work. Their combined income is $66,625, which is equal to 250% of the federal poverty level for 2026. We're going to walk them through getting coverage for 2026. So remember, the first thing the marketplace application will do is screen for Medicaid eligibility. With an income of 250% of the federal poverty level, Ramon and Lucia won't be eligible, and Amelia won't be eligible for CHIP, which covers kids up to 217% of the federal poverty level in Delaware. So Ramon is offered coverage through his job. The premiums just to cover him, the employee only, would be $500 a month or $6,000 a year. His employer also offers coverage for the employee and dependents, although not spousal coverage. The employee and dependent coverage would cost them $700 a month. So the question is his family eligible for premium tax credits on the marketplace? So we need to recall for this the criteria for crossing the firewall and getting a premium tax credit even when a person has an offer of employer coverage. A person can't get a premium tax credit if they have an employer offer that meets 3 criteria. Is it real coverage, meaning it's not accident or indemnity coverage, it's truly insurance? Is it affordable? And this threshold changes every year, but this year insurance that costs less than 9.96% of household income is considered affordable. And finally, is the offer comprehensive, meaning it meets the minimum value standard for coverage. The ESI offer has to meet all 3 of these criteria, and if any one of them is missing, then the person can qualify for a premium tax credit, assuming that they meet other eligibility criteria. Oops. There we go. So let's assume that the coverage is in fact real health insurance coverage, his offer, Ramon's offer from his employer, and that it does meet the minimum value standard. And remember, if you're not sure if a plan meets the minimum value standard, this information is available on the summary of benefits and coverage for the plan. And every plan has to have a summary of benefits and coverage. It's just a matter of tracking that down, which sometimes can certainly be a challenge. But if you're able to get your hands on the individual's offer and the summary of benefits and coverage that go with that, you'll find a question that asks whether the plan meets minimum value around page 6 or so of that SBC, and you can confirm that information there. We'll assume that Ramon's plan meets both of these criteria, but what about affordability? So the affordability threshold is a percentage of household income, and it is indexed, so it changes every year. And as I mentioned, for 2026, an offer of employer coverage is considered affordable for the employee if the employee contribution for self-only coverage is 9.96% of household income or less. The offer is considered affordable for the spouse and dependents, assuming there's an offer made for all of those individuals, if the employee contribution for family coverage is 9.96% of household income or less. A family member can also get a premium tax credit if the employee's offer doesn't cover them or if they aren't on the employee's tax return. So you can see these affordability questions on the screenshot of the employer coverage tool on healthcare.gov, which is not required, but it can be a helpful way to gauge what coverage the person is offered and whether it might or might not meet these key criteria. So getting back to the Rodriguez family, let's walk through each member of the household, starting with Ramon. He has an offer of ESI, of employer coverage, and at $500 a month, it is 9% of their household income. So the offer is considered affordable, which means he is not eligible for premium tax credits. Now on to Amelia. As Ramon's daughter, she is eligible for the employer plan, but the plan would cost them $700 a month, which is 12.6% of their household income. So the offer is not considered affordable, which means Amelia is eligible for premium tax credits. And finally, for Lucia, she can't enroll through Ramon's coverage because they don't offer a plan that covers spouses. She also doesn't have an offer of coverage through her own job, so she is also eligible for premium tax credits. So here is a summary of where we landed. Remember that although Ramon isn't eligible for premium tax credits, he could choose to enroll in a full cost marketplace coverage plan if he wanted to. Now, that is often, most of the time, not affordable for people, but technically it's an option, and it might be important to keep in mind in certain cases where it would be important for the family all to have the same provider network, for example. Lucia and Amelia will enroll in marketplace coverage with premium tax credits, and that is definitely the best option for them. So now at tax time, let's look at a couple more little wrinkles here. Lucia considers filing as married filing separately, which she doesn't think will affect her premium tax credit eligibility since Ramon has coverage through his job. So the question is, can she still get premium tax credits if she files separately? I can hear you all through the internet waves here. You're telling me no, she can't get coverage if she doesn't file jointly with Ramon, because in order to get premium tax credits, you must have an eligible tax filing status, and married filing separately is not one of those. The one exception is if she happens to qualify for one of the exemptions, which are head of household, being a domestic violence survivor, or an abandoned spouse. Lucia is none of those things, which means that if she files married filing separately, the family will owe all of the premium tax credits she and Amelia received back at tax time. Now, because the advanced premium tax credit repayment caps have been eliminated starting in the 2026 year, when they file in 2027, again, if they filed married filing separately, they would owe all of their premium tax credit back with no limitations. I already mentioned this, so just to say, you have to file as single or married filing jointly or head of household in order to qualify for premium tax credits. The person claiming the premium tax credit can't be a dependent. If they are, then the tax filer claiming them as a dependent has to claim the premium tax credit on their behalf. People can select single if they qualify for one of the exceptions for survivors of domestic violence or abandoned spouses, and they do not need to submit paperwork to verify this. Okay, one more little wrinkle. What if Ramon and Lucia are now divorced? Let's assume that Ramon has primary custody of their daughter, Amelia. Because she and Lucia are both enrolled in the marketplace, Lucia wants to claim Amelia as a dependent on her taxes so that she can claim premium tax credit for Amelia. The question is, can she do this? No, typically she cannot do this. The custodial parent typically claims the child for tax purposes. So Ramon could claim premium tax credit for Amelia, although If she would be in a child-only plan, I would say proceed with caution because these can be tricky. But when the household has separated into two separate households, it depends on what Ramon's ultimate income is, because he might be eligible for a premium tax credit now too, depending on his income at the time. Another alternative, though, would be for Ramon to sign tax form 8332, which would allow Lucia to claim Amelia on her taxes, even though she is the non-custodial parent. In that case, Lucia could claim premium tax credits for Amelia. Okay. With this, I'm going to turn it back over to Nicole. And I think we are going to Q&A. No, maybe not.
We can pause for a quick Q&A. So, question for you, Jenny. So, when a family has mixed eligibility for premium tax credits, for example, in one of the examples where Ramon has an offer of ESI as minimum essential coverage and Lucia and Amelia do not, is Ramon still part of the household for purposes of determining premium tax credits?
Sure, that's a great question. Yes, the household is always, for premium tax credit purposes, the household always follows tax filing rules. So they will be filing as a single household when they file their taxes. And so Ramon will be part of that household, as will his income, even though he is not himself enrolling with a premium tax credit or potentially at all.
Thank you for clarifying that, Jenny. We will move on there and circle back to actually, one more question just came in. All right. If the custody of a child is shared between two parents, how do we know who will be the primary custodial parent?
So it depends. For premium tax credit purposes, it is who is claiming the child on their tax returns. We can do a little bit of digging and get back to you after the webinar in terms of some of the nuances there.
Thank you, Jenny. Okay, moving on to our next scenario. This is Greg and Cynthia, and we will talk about Medicare. So meet Greg and Cynthia. They are married and will both turn 65 in 2026. Together, they have a household income of $40,000 or 189% of the FPL. They are currently enrolled in a market plan with both premium tax credits and cost-sharing reductions. This example will discuss transitioning from Marketplace to Medicare coverage, ending Marketplace coverage, and periodic data matching. So let's start with Greg. Greg turns 65 on March 14th, 2026. He qualifies for premium-free Medicare Part A. His Medicare coverage begins the first day of the month he turns 65, which is March 1st, 2026. So Greg will no longer be eligible for premium tax credit or cost-sharing reductions as of March 1st, 2026. The healthcare.gov application now collects Medicare start dates from Marketplace enrollees. So people can go into the Marketplace and provide a Medicare start date in the past or up to 3 months in the future. Healthcare.gov will end their Marketplace coverage at the appropriate time for enrollees transitioning to Medicare to avoid an overlap in coverage. If they use this option, it is no longer necessary to contact the Marketplace call center to end Marketplace coverage for people enrolling in Medicare. Backing up a little bit, let's discuss whether Medicare qualifies as minimum essential coverage. As a reminder, if someone is eligible for minimum essential coverage through a non-Marketplace channel, they cannot receive premium tax credits. Premium-free Medicare Part A, hospital insurance, and Part B, medical insurance, premium-free Medicare Part A only, or Medicare Part C, also known as Medicare Advantage, are all minimum essential coverage. However, Medicare Part B only, or voluntary Medicare, in which a person pays a premium for Part A and may or may not be enrolled in Part B, are not minimum essential coverage. Let's turn to Cynthia. She is in a somewhat different situation. She is not eligible for automatic enrollment into Medicare Part A and must actively enroll. Her Medicare Initial Enrollment Period, or IEP, begins 3 months before her birthday, which is August 4th, and ends 3 months after. So the IEP runs from May to November. If she enrolls any time from May to July, her Medicare coverage begins August 1st. If she enrolls from August to November, her coverage begins the first day of the month after she signs up. If she does not enroll during her IEP, she would have to wait for the Medicare General Enrollment Period from January to March 2027 to enroll, and could face late enrollment penalties. Cynthia is no longer eligible for APTC and CSRs as of the first day of the month her Medicare coverage begins. If she is eligible for premium-free Medicare Part A but doesn't enroll, she would lose PTC and CSR as of the first day of the 4th month after she turns 65. She decides to enroll in Medicare with coverage beginning August 1st, 2026. So Greg's Marketplace coverage will end on his Medicare start date, March 1st, while Cynthia will stay enrolled in her Marketplace plan. She qualifies for a special enrollment period when Greg enrolls in Medicare and is no longer enrolled in their Marketplace plan. Cynthia will likely have a new premium responsibility for her Marketplace plan. She qualifies for an SEP. Her insurance plan has the option to reset her spending toward her deductible and out-of-pocket maximum. If Cynthia did not enter her Medicare start date in the Marketplace during her IEP, she would have to call the Marketplace to end her Marketplace coverage. The household contact for the plan will stay the same and should not be removed from the application, even if that person no longer needs Marketplace coverage. The Medicare enrollee can remain the household contact. If the household needs to change the household contact for another reason, for example, death, then they would need to use the Marketplace call center to do so. Technically, both Greg and Cynthia could remain on Marketplace coverage through the end of the year, but they would lose eligibility for APTC and CSR the first day of the 4th month after turning 65, and if they didn't end APTC, they would have to pay them back for the overlapping months when they file their 2026 taxes. They would likely get a periodic data match or PDM notice if they enrolled in Marketplace, if they remained enrolled in Marketplace after enrolling in Medicare Part A. If Greg or Cynthia do not end their Marketplace coverage once they enrolled in Medicare and did not enter their Medicare start date in healthcare.gov, they may receive a periodic data matching notice or PDM. People who receive a PDM notice have 30 days to return to the Marketplace and end PTC and CSRs, terminate Marketplace enrollment, provide written documentation that they're not enrolled in both programs, or change their response to the automatically end coverage question. Because Cynthia was already enrolled in a Marketplace plan, she could keep her Marketplace coverage in 2026 instead of transitioning to Medicare, but she would lose PTC and CSR as of the first day of the 4th month after she turned 65, and she would face penalties if she later enrolled in Medicare. These are some example numbers using the Open Enrollment 2026 Georgia Window Shopping tool for Savannah, Georgia. Her current Marketplace plan with APTC that she could stay on until December 1st costs $203 per month. If she stayed enrolled in her Marketplace plan without PTCs, it would cost $1,635 per month. Medicare Part A and B premiums are not yet published for 2026. These are estimates from the Medicare Trustees Report. If she enrolled in premium-free Medicare Part A and Medicare Part B, she would pay $207 per month. She and Greg may also qualify for Medicare savings programs to lower the cost of their Medicare premiums. If she does not enroll in Medicare, she could face Part A and B enrollment penalties for enrolling in Medicare later. Now, if Cynthia were single with the same annual income of $40,000 and had to pay a premium for Medicare Part A, for example, if she did not have sufficient work history to qualify for premium-free Part A, she could keep marketplace coverage with APTC and CSR, but would lose APTC and CSR and face penalties if she later enrolled in Medicare. Her marketplace plan with PTC costs $287 per month. Medicare Part A with premiums costs $536 per month or less if she paid Medicare taxes for 30 to 39 quarters. Part B premiums are $207 per month. So her total premiums for Part A and B are $770 per month. Note that she would be subject to late enrollment penalties if she sticks with her marketplace plan and later enrolls in Medicare. All right, we can pause here if any questions have come in. Jenny, is there anything to ask here?
We actually don't have any questions at this time, so I think we can keep moving.
Great, I will pass back to Claire.
Okay, so our next scenario of the day will focus on redetermining PTC eligibility, automatic re-enrollment, and APTC repayment. All right, before I get into Darcy's scenario, just wanted to provide a quick reminder that the marketplace uses the previous year's federal poverty guidelines to determine eligibility. That can be a bit confusing, and we'll see that throughout this scenario, so just wanted to clarify that up front. Okay, so during last year's open enrollment period, Darcy enrolled in a bronze plan for 2025. She projected her income at $35,000 or 232% of the federal poverty level based on the 2024 federal poverty guidelines. In April 2025, Darcy files her 2024 taxes. Her actual income for 2024 was $38,000 or 261% of the federal poverty level based on 2023 poverty guidelines. In September, Darcy realizes that her jewelry business is not making as much money as she expected, so she returns to the marketplace and changes her projected income from $35,000 to $32,000, or 212% of the federal poverty level based on 2024 poverty guidelines. During this year's open enrollment period, Darcy does not return to the marketplace to update her information. Which number does the marketplace use to redetermine her PTC eligibility? Is it A, her projected income from open enrollment for 2025, B, the income from her 2024 taxes, C, the income for her 2024 taxes adjusted for 2025 FPL guidelines, or D, her projected income from September adjusted for 2025 FPL guidelines? And the answer is D, her projected income from September adjusted for 2025 FPL guidelines. Let's take a look at why this is. As a reminder, if someone is enrolled in a marketplace plan and they do not return to the marketplace during open enrollment to actively update their information, in many cases, the marketplace is able to use available information to redetermine their eligibility for PTCs and CSRs. The marketplace will use the most recent income information available, adjusted to 2026, using the 2025 federal poverty guidelines. So most recent income information available for Darcy would be that September 2025 projected income. All right, so first the marketplace will see if there's 2025 projected income. If there's no 2025 projection, the marketplace will use 2024 data. And if neither 2025 projected income nor 2024 tax data is available, in that case, the marketplace would use projected 2024 income to redetermine eligibility for PTCs and CSRs. Keep in mind, though, not every marketplace enrollee is eligible for automatic PTC redetermination. Someone is eligible for redetermination if they authorized healthcare.gov to pull tax data related to their income and household size, if they updated their application at some point in the past 2 years, if they enrolled in 2025 coverage with a PTC and/or CSR, and if they don't fall into one of the special groups that cannot be redetermined. Those special groups are listed below in the red boxes. So people who opt out of authorizing healthcare.gov to pull tax data are not eligible for redetermination, nor are people who have been passively enrolled for 2 consecutive years. People who aren't currently receiving PTC or CSRs aren't eligible for redetermination, nor are households where a member of the enrollment group has Medicare. Also, if someone received a PTC in the previous 2 tax years and didn't file taxes, or filed but didn't reconcile their APTC for both of those years, they are not eligible for APTC unless they file and attest in the application to reconciling the previous year's PTC. If someone is not eligible for redetermination, they will still be automatically re-enrolled, but they won't get PTC or CSRs unless they either update their income information and household information, or if they file and reconcile if they've failed to do so. All right, take note though that beginning in plan year 2028, there is a change coming to the failure to reconcile process. So the marketplace will terminate PTCs if a person who previously received PTCs has not filed their taxes or filed and failed to reconcile PTCs for 1 year rather than 2 consecutive years. This applies in all states. And to clarify, now and in the future, this only applies for years in which a person received PTCs and did not reconcile them. We've gotten a few questions about, for example, if a person previously had Medicaid or employer-sponsored insurance and their income was too low for taxes, would that disqualify them from PTCs? And the answer is not necessarily. The failure to reconcile policy automatically deems people ineligible for PTCs if they didn't file taxes and reconcile their PTCs in previous years. So if they didn't receive PTCs in previous years, they would not be ineligible for PTCs for this reason. Okay, getting back to Darcy, let's see how much PTC she is eligible for in 2026. First, so as we said, during 2025, Darcy updated her income to $32,000, which is 212% of the poverty line. With the enhanced PTCs in place, she does not have to pay more than 2.48% of her income, or around $66 a month for a benchmark plan. So we subtract the cost of the benchmark plan in 2025 from Darcy's expected premium contribution and see that she gets a PTC of $275 a month. To redetermine Darcy's PTC eligibility for 2026, the marketplace takes her FPL from 2025 and updates it for the next year. So 212% of the poverty line using the 2025 federal poverty guidelines is $33,178. Assuming that the enhanced PTCs will no longer be in effect for plan year 2026, Darcy's expected premium contribution will be 7.04% of her income, or $194 a month. We subtract that from the cost of the benchmark plan in 2026, and we see that Darcy is eligible for a premium tax credit of $204 a month in 2026. Okay, So the marketplace has redetermined Darcy's PTC eligibility for 2026. Now let's take a look at how automatic re-enrollment works for her. Now, typically, if a marketplace enrollee does not return to the marketplace to update their information and select a plan during open enrollment, the marketplace will automatically re-enroll them in the plan that they had the previous year. However, Darcy's insurer is not offering her 2025 health plan for 2026. Which plan does healthcare.gov automatically re-enroll her in? Is it a silver cost sharing reduction plan from the same insurer she had the past year with premium tax credits? A bronze plan from the same insurer she had last year with premium tax credits? Or a bronze plan from the same issuer she had last year but without premium tax credits? And the answer is Plan B, a bronze plan from the same insurer she had last year with premium tax credits. So let's go over some more changes coming to the ACA marketplace that explain why Darcy was automatically re-enrolled in the plan that she was. Previously, people eligible for cost-sharing reductions who were enrolled in a bronze plan and who did not return to the marketplace to select a plan would be automatically re-enrolled into a silver plan if certain conditions were met. This bronze to silver crosswalk is going away for plan year 2026. So people eligible for cost-sharing reductions who are enrolled in a bronze plan in 2025 will be automatically re-enrolled into a bronze plan for 2026 in most cases. This applies in all states, although state-based marketplaces can apply to HHS to request a different re-enrollment process. This policy is also scheduled to sunset at the end of next year, so there could be changes then. In addition, beginning with re-enrollments for plan year 2028, marketplace enrollees who do not return to the marketplace to update their information and verify any information that can't be confirmed in electronic databases will be determined ineligible for PTCs. They will still be automatically re-enrolled in coverage, but they will be responsible for the full cost of their health plan until they verify their APTC eligibility. So if this situation occurred during open enrollment for plan year 2028, Darcy would be automatically re-enrolled into a plan without PTCs. But currently, she is still going to be automatically re-enrolled into a plan with PTCs since that policy change hasn't gone into effect yet. Now, let's say that Darcy doesn't like the plan that she was automatically re-enrolled in. If she realizes this during open enrollment, she can select a new plan. If she realizes she doesn't like her new plan after open enrollment, she still has time to switch plans because she qualifies for a special enrollment period. If an enrollee's 2025 plan is discontinued and they're automatically re-enrolled in a different plan, either with a different insurer or the same insurer that they had previously, they are eligible for an SEP based on loss of other qualifying coverage. They can use this SEP to change plans up to 60 days before or after the discontinuation date of their 2025 plan, which is December 31st. If the person uses the SEP to pick a new plan before December 31st, then their plan will go into effect on January 1st. If they use the SEP to select a new plan after January 1st, their plan will become effective on the first day of the month following plan selection. Enrollees do not need to verify eligibility for this SEP because the marketplace already has information about which qualified health plans have been discontinued. So now we fast forward to April 2026. Darcy is filing her 2025 taxes and realizes that her actual income was actually much higher than what she projected. Her actual income was $45,000 or 299% of the poverty level. Darcy must reconcile her APTCs. Does she owe the full amount of excess APTC she received? Jenny kind of previewed this earlier, but no, she doesn't. For plan year or tax year 2025, the APTC repayment limits are still in effect. Since Darcy earned under 300% FPL and is a single taxpayer, her APTC repayment is capped at $975. However, if she underestimates her income in plan year or tax year 2026, she will have to repay the full value of excess APTCs that she received when she files her taxes in 2027. Darcy can avoid a large repayment burden on her 2026 taxes by updating her projected income throughout the year and/or taking less APTC than she's eligible for. These are the PTC repayment limits that are in effect for tax year 2025. As we said, because Darcy is a single taxpayer with income below 300% of the poverty line, her APTC repayment is capped at $975. However, starting in tax year 2026, full APTC repayment will be required for people whose actual income is higher than their projected income, unless their income falls below 138% FPL in Medicaid expansion states or falls below the poverty line in non-expansion states. I'll conclude just by taking you through some of the math in this situation. So if we recall, Darcy estimated that her annual income was $35,000 at the beginning of the year. And in September, she updated her income projection to $32,000. So that went into effect beginning in October through the end of 2025. So here I've taken the monthly PTC that Darcy would have received based on her income projection, and I've multiplied it by the number of months that she had that income projection to get the annual PTC received number in the bottom line in white. And then I've added up those two numbers to get the PTC that she received in 2025, which was $3,030. But based on Darcy's actual 2025 income of $45,000, she was actually eligible for an annual PTC of $1,416. For plan year or tax year 2025, her PTC repayment would be capped at $975. However, if this happened in plan year or tax year 2026, she would owe the full amount of excess PTC received. So that would be $3,030, the amount that she received, minus $1,416, or the amount that she was eligible for based on her actual income. And she would owe a total of $1,614. In the end, Darcy would end up paying $639 more without the APTC repayment cap. Okay, and I believe that brings us to the end of today's scenarios, at least, but we do have some time to take a few questions.
Yes, thank you, Claire. All right, this first question is for you, Claire. What if someone can't afford to repay APTCs?
Right, so this would be treated the same as if someone wasn't able to fulfill any other portion or wasn't able to pay any other portion of their tax liability. So the IRS offers some repayment options, including short-term extensions to pay, the ability to pay in installments, or temporarily delaying repayment. And you can go to the IRS website to apply online for a payment plan and see what is available for people in, a specific situation.
Thank you. All right, this next question is about Medicare, so I will take it. It is, if someone is not eligible for automatic enrollment into Medicare, how can they enter their Medicare start date in advance on the Marketplace application? So a person can enter their Medicare start date up to 3 months in advance. So their IEP, their initial enrollment period, begins 3 months before they are eligible to enroll in Marketplace, which is the first day of the month in which they turn 65. So if they enroll in Medicare during their IEP before their Medicare start date, they can enter their Medicare start date as soon as they know it. All right. One more thing to note is that we have a scenario we have skipped through for time purposes that deals with COBRA and the loss of minimum essential coverage. That special enrollment period for the loss of minimum essential coverage. So when the link to the slides in the chat, so you can see that there. We have time for one more question. I can take this one. So how does someone qualify for Medicare Part A with premiums or without premiums? So as you can recall, Medicare Part A without premiums is minimum essential coverage. And if they qualify for Medicare Part A with premiums, they have the option to enroll in that or continue to receive APTCs, although they would, when they do enroll, if they do enroll in Medicare at a later date, they might face penalties. So this is going to sound a little bit technical, but consumers qualify for premium-free Part A coverage if they or their spouse worked for the equivalent of 10 years, either consecutively or non-consecutively, at jobs where they paid Medicare taxes. Sometimes that's called having qualified quarters of coverage, or they're eligible to receive retirement benefits from Social Security. They have received disability benefits for 24 months or are receiving ALS disability benefits, or they have end-stage renal disease and meet other specific requirements, including having the required qualifying quarters of coverage. All right. With that, I think we are out of time on Q&A. Please feel free to reach out if you have any other questions. This is the Cobra SEP you should check out later. And if you have questions or need assistance, please email the Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we will bring this webinar to a close. Thank you again for joining us today, and please reach out if you have any questions. Thank you.